Hello, everyone. My name is Caprice Chaplin, and today I'll be presenting on the advocacy of equitable mental health crisis response. On this, advocacy is one of the most core responsibilities of social workers. Because of our roles go beyond helping individuals, we also examine systems and policies that create barriers to care. With this, the current events I chose focuses on recent debates surrounding mobile crisis teams and 988 crisis services. While these programs have expanded access to behavioral health care, recent funding concerns and policies changes have raised questions about whether people experience mental health crisis will continue receiving timely, equitable, community-based support. Through this presentation, I will discuss the problems being addressed, the population and systems involved, also how advocacy occurs in the macro, meso, and micro level, and the role of diversity in social justice, and how a Christian worldview can strengthen ethical advocacy. So, with current events. So, current events. This current event highlights a turning point in crisis care across the United States. So, one of the news articles from Cal Matters explains that California mobile crisis team have demonstrated positive outcomes because pro, because proposed funding changes could leave countries responsible for covering major financial gaps. If those services become optional rather than guaranteed, many communities may lose access to crisis response before situations become emergencies. The second news article from the Associated Press discusses concerns surrounding specialized 988 crises. These debates demonstrate in the crises for LGBTQ plus youth. These debates demonstrate that crisis care is not only about answering phone calls, it's about deciding who has access to specialized support during some of the most vulnerable moments of their lives, sorry. Together, these events show these that advocacy is necessary to protect uh, equitable access to mental health service before people reach emergency rooms, jails, and law enforcement. So, problems being addressed, access is unequal. So the central problem is unequal access to mental health crisis care. Many people assume that individuals refuse treatment because they simply don't want help. However, research studies suggest that the issue is more complex. Barriers such as poverty, transportation, language differences, discrimination, stigmas, lack of insurance, and shortage of providers can prevent people from receiving care before their condition worsens. Um, when crisis services are unavailable or difficult, um, to access, people often enter the system through emergency departments or police involvement rather than receiving early interventions. As social workers, we must shift our perspective from blaming individuals and identifying structural barriers that limit access. Advocacy means addressing those barriers so crisis services are available before s- situations become dangerous. So, population and systems involvements. This issue affects many different populations. People experience behavioral health crises are directly impact people experiencing behavioral health crises are directly impacted, but so are the families, caregivers, rural community, low income population, immigrants, refugees, racial and ethnic minority groups, and LGBTQ plus youth. Several systems also play important roles. These include the 988 Lifeline, uh, county behavioral health agencies, health hospitals, emergency departments, law enforcement, nonprofit organizations, and peer support specialists. Because with this, because sorry, I lost my thought. Because multiple organizations work together, this much is much more than an individual level issue. Decisions make for legislators, funding agencies, healthcare organizations, and community providers all influence whether people receive timely and compassionate crisis care. So, with the macro, meso, and micro levels, social workers promote justice at three different practice levels. At the macro level, advocacy focuses on legislation, Medicare policies, Medicaid policies, funding decisions, and public policies that determine whether the crisis or response programs receive um, long term financial support. Let me go back. At the meso level, organizations coordinate mobile crisis teams, partner with hospitals and community agencies, and train peer support specialists to improve service delivery. And at the micro level, social workers provide direct support by completing assessments, de-escalating crises, and creating uh, safety plans and connecting clients and ongoing resources. Each level depends on the other. Strong policies support effective organizations, and effective organizations improve individual client outcomes. So, with diversity and social justice, must maintain central to crisis responses. Social workers cannot assume that every client experiences mental health services in the same way. Culture, language, religion, family values, immigration status, disabilities, sexual orientation, and previous experiences with healthcare all influence whether someone feels safe seeking help. Advocacy includes providing cultural responsive care, reducing language barriers, partnering with community organizations, and evaluating whether services are reaching underserved populations. Rather than expecting people to navigate and complicated systems alone. Social workers bring that service into communities and meet people where they are. So, with the Christian worldview supports advocacy by emphasizing compassion, dignity, and service to others. Matthew 25 teaches believers to care for vulnerable people by serving those in need. For social workers, this means advocating for systems that value each person's dignity, regardless of their mental health status or life circumstances. However, it can also it's important to respect personal ethics. Social workers should never impose their personal beliefs on clients. Instead, faith should serve as a personal motivation for ethical practice while continuing to respect clients' self-determination and then cultural diversities and professional boundaries established in the NASW Code of Ethics. So with social work action plans, one practical way social workers can respond begins with assessments. First, identity, which community experiences the greatest barriers to access crisis services. Second, advocate. Advocate for continued funding in mobile crisis teams, peer support specialists, and specialized programs. Third, um, build partnerships among healthcare's providers, schools, churches, non profits, and local agencies to strengthen community resources. And finally, evaluate. Evaluate outcomes using measurable data to determine whether services are truly reaching diverse populations and improving equitable access. Advocacy is not a one-time event. It's an ongoing process of assessments, collaborations, and continuous improvement. So, call to action. In closing, mental health crisis care should never depend on whether someone lives, how much money they have, or whether they fit within a particular system. Social workers have the responsibility to advocate for policies that protect funding, expand specialized crisis services, strengthen community partnership, and ensure that all individuals receive respectful, culturally responsive care. Culturally, yeah, responsive care. The goal is to create systems that respond before a crisis becomes tragedies. Advocacy transforms crisis response from a last resort into a accessible pathway towards recovery, dignity, and hope. Thank you for your time, and I appreciate you listening and watching this.